Welcome everyone to this joint education class. This presentation is to educate you on your general rehabilitative care for your total knee or total hip replacement surgery. First and foremost, thank you for selecting Randolph Health as the medical facility to have your joint replacement surgery. Throughout this presentation, you will see page numbers in parentheses in the title slides. This refers to specific pages in your joint notebook. In this presentation, we will discuss joint disease and replacement surgery. We will discuss what to expect in the hospital, how to get ready for discharge from the hospital, and your rehabilitation after surgery. Please write down any questions that you may have to share with your surgeon. One of the first things to understand is who your support system is. Your coach is typically a close family member who can offer support at home. You will not be able to go home after surgery alone. Your orthopedic surgeon performs the operation, and physical and occupational therapists help guide you through the rehab process and work to ensure maximum independence and function. Finally, your case manager is introduced to you in the hospital following your surgery. Their job is to set up follow-up physical therapy and ensure you will have all necessary equipment for home. Joint replacement surgery is the removal of a joint or joint surfaces that are causing you pain and replacing them with an artificial joint. The top image that you see here on the right side of the page shows a artificial total knee joint and some of the components involved in that. And the bottom image shows some componentry involved in a hip replacement. So our goals for joint replacement surgery will be to decrease your pain, improve your mobility, and improve your joint function. Some frequently asked questions are, how long will your joint last? Typically, your joint replacement will last 10 to 20 years on average, but everybody is different. In general, the more that you use your joint, the longer that it will last. Typically, you'll be in the hospital for one night if you're discharging immediately to home, and if more rehab is required after discharge, you may spend up to 3 nights in the hospital. The average surgery takes about 1.5 hours, but including recovery time may take up to 3 hours. You'll go home with certain equipment. You'll be given an ADL kit, which means an activity of daily living. So these are things to help you with your function at home. You'll be given a reacher, a long-handled sponge, a long-handled shoehorn, and a sock aid. You will also be given a rolling walker and a bedside commode, which insurance will typically cover. A common question is, when will I be able to return to normal activity? This depends on your orthopedic surgeon and also depends on your individual situation. For driving, it will depend on which leg of the surgery was performed and what type of transmission your car has. For instance, right lower extremity surgeries tend to take a little bit longer to return to driving than left-sided. And your full return to work is dependent on the demands of your job and what your orthopedic surgeon has counseled you. Prior to surgery, consult your doctor about exercise. It's important to remain physically active. Specific therapeutic exercises are provided in the back of your joint notebook. Research shows that learning these exercises and improving strength improves general surgical outcomes. Smoking will impede healing, so it is important to refrain from smoking. The surgeon will tell you which medications to continue and which to stop, and be sure to obtain clearance from any other medical providers, which could include a cardiologist, a urologist, a nephrologist, etc. And be sure to be aware of the obstacles and the setup of your home. Be aware of how many steps there are in the home, both to enter the home and once you're inside. Be aware of any small rugs that you may have and pull those up if you can. And also be aware of any pets inside the home. 7 days before surgery, it's important to stop taking fish oil, aspirin, anti-inflammatories, and any other meds that your doctor tells you to avoid. You're going to shower every day regularly like you normally would with soap and water, and you will also be using the Hibiclens body wash on a wet washcloth to clean everywhere except for your face and your private areas. The day before surgery, it's important to not eat or drink anything after midnight. And it's also important the night before to take a shower, and after you dry off, you're going to use the 4 Hibiclens wipes. Your packet has 6 wipes in them. You're going to use 4 of them, and just follow the instructions of the order to use them, referring to pages 13 through 14 in the notebook. And after you clean yourself off with the Hibiclens wipes, sleep in clean pajamas and clean sheets. Also, it's important to not shave anywhere before the surgery and avoid using perfumes, deodorant, shaving creams, or lotions. Last point, it's important to not let your pets sleep in the same bed as you. To the hospital, you should bring your joint notebook. You should bring any health insurance information and any other papers the surgeon has advised you to bring. Also, this is very important to make sure that your clothes are able to accommodate swelling. This can be sweatpants or shorts. Really, jeans are quite restrictive, so we would not recommend those. Make sure shoes that you bring have a rubber sole and that they're able to accommodate swelling. The clothes and shoes that you do have, try to have at least 3 days worth in case your hospital stay needs to be extended. On the day of your surgery, please make sure that you arrive on time and do not shave. You will enter the outpatient center across the street from the orthopedic office and go to the outpatient information desk. From there, a volunteer will take you to the surgery area, and we advise you to take a wheelchair because it's a long walk. For your safety, you'll be asked some questions to verify your name and birthday. Your family will be able to be with you until you go back for surgery.
Once you're taken back to your room, PT and OT will check on you that afternoon. Therapy sessions at this time are only what you can do. Some people are able to walk, but other people just stand and return to bed. It all depends on what you are able to do and how you're feeling. A continuous passive motion machine, CPM machine, may be applied for total knee replacements. If PT and OT cannot get you out of bed on surgical day, nursing will get you out of bed. And at this time, a case manager will begin your discharge planning once they get the OT and PT notes and see what they recommend. Following your surgery, post-op days, your surgeon will visit. He or she may answer any questions that you may have. PT and OT will also assist you with everything you need to go home, whether that involves walking, therapeutic exercises, stair training if you have stairs, education for home, and ADL training. ADL training pertains dressing, toileting, bathing, cooking, anything that you can think of that you do on a regular day. And as far as case managers, they will help you set up follow-up physical therapy services and will get you all the needed equipment, whether that's a walker, a cane, anything else that you may need. As far as pain management, as with any surgery, it's important to remember that you will have pain. We do our best to help decrease your surgical pain while you're at the hospital by using medication, ice, and the CPM application. Both nursing and your doctor will assist with pain management as needed. As far as home health services are typically only for total knee replacements, not really for any total hip. Home health therapists typically come to your home the next day if they are ordered. Again, this depends on your surgeon and what surgery you had done. And the therapists themselves will determine the frequency of the visits. In some cases, you may need more assistance than home health can provide. Some people are often recommended to attend a skilled nursing facility where they can assist you with more of those ADL activities and help you get your strength back before you return home. All of this depends on if you have family or friends that can support you once you go home, or if you just need more therapy before you return. After home health, a lot of patients go to outpatient rehab, where they are offered a variety of treatments, options, and it's designed to help speed up your return to work and your normal daily activities. You must have transportation to and from this facility. And again, a case manager may help to set that up. Once you're home, you will have a follow-up visit with your surgeon. You may have bruising on your legs. You may also notice muscle soreness and/or difficulty sleeping at night. A lot of people frequently have dry mouth after surgery, and you may also experience decreased energy. As far as pain management, please take your medicine as scheduled. If you plan to attend rehab, please plan to take your medication 30 minutes prior, just so you are able to maximize your ability to participate in your session. Your surgeon will wean you off of prescription medication slowly, and we also recommend using ice packs to help decrease pain and swelling from your surgery, but please do not use heat. As far as surgical risks, there are a couple of things that you need to keep in mind. The first thing being a deep vein thrombosis. If you notice increased swelling that does not decrease with elevation, either tenderness or pain in the calf, this may be indicative of a DVT. If you are having any of these symptoms on this chart to the right, please alert your surgeon because you may have a DVT. Preventing DVTs involve physical therapy exercises, medications, general mobility, changing positions, and getting out of bed. We just recommend that you are constantly moving around, and this will decrease your risk of developing a DVT. A pulmonary embolus occurs when a blood clot is dislodged and travels into your lungs. If you experience any sudden pain in your chest, breathing that becomes rapid/difficult, shortness of breath, confusion, and increased sweating, this is a medical emergency and you need to call 911 immediately if you have any of these signs. As far as infections go, your surgeon will give you instructions on how to take care of your incision. Signs of an infection can include redness, drainage from the wound, or elevated temperature. If you have any of these symptoms, please alert your surgeon and they can help you however necessary. After your surgery, please notify medical professionals of your surgery. Medical practitioners may prescribe short-term antibiotic prior to other treatments. You will need to follow this precaution for as long as your doctor prescribes. As far as precautions go, please see your notebook, specifically for whether you had a hip or knee. As far as hip surgeries go, There are no true precautions if you are receiving the anterior surgical approach. If you had a total knee conducted, there aren't any true precautions. The only thing we tell our patients is to not use a pillow underneath the knee. All joint replacements are typically weight-bearing as tolerated, but please ask your medical provider / surgeon what they specifically want for you. In conclusion, our goal is to meet your needs and enable you to return to your daily routine as soon as possible. We will be with you every step of the way. Thank you for allowing us to partner with you for your joint replacement care. If you have any questions, please direct any further questions to your surgeon.